Hello, and welcome to the ClotWise Education Program. My name is Dr. Matthew Becker. I'm a cardiologist who has cared for many people with atrial fibrillation, commonly called AFib. You may have just been diagnosed with AFib, or simply need a refresher about what it is. But no matter your level of knowledge, my goal is to help you learn more about what's happening in your body. We'll explore why people with AFib are at risk for stroke, and we'll learn about the different treatment options your doctor may use to manage both your AFib and your stroke risk. So what is AFib really, and what does it mean for your health? AFib is the most common type of irregular heartbeat. It affects up to 6 million men and women in the US alone. It's often not possible to know the exact cause of AFib, but common risk factors include older age, heart disease or other chronic conditions like diabetes or sleep apnea, high blood pressure, being overweight, or a family history of AFib. People with AFib have disorganized electrical signals in the heart. This causes the upper and lower chambers, the atria and the ventricles, to beat out of sync. This may feel like your heart is fluttering or racing. However, people with AFib often feel no symptoms at all. But whether or not you feel symptoms, your doctor can confirm AFib using an EKG. An EKG, or electrocardiogram, detects the abnormal electrical signals in your heart. What happens in AFib is that blood doesn't get pumped through the heart all the way. Picture a sponge that hasn't been fully squeezed out. This can cause blood to pool inside the atria, where blood clots can form. If a blood clot gets pumped out of your heart, it can travel through your bloodstream to your brain. If it reaches your brain, it can cut off blood flow and oxygen. This can cause a stroke that could be disabling or even life-threatening. Because many people have never heard of AFib, diagnosis may come as a shock. Finding out there is a risk for stroke may be surprising too. But while AFib may seem like it is primarily a heart problem, by itself it's not usually life-threatening. The greater concern is actually the risk of stroke. In fact, people with AFib are 5 times more likely to have a stroke than people without AFib. Not only that, AFib-related strokes are deadlier than strokes not caused by AFib, and the risk of having one increases over time. But it's important to remember that you and your doctor can work together to manage your AFib and your risk of stroke. In general, there are 2 treatment goals for AFib. One is to return your heart rate, heart rhythm, or both back to normal. Your doctor may prescribe rate control medicines like beta blockers, calcium channel blockers, or digoxin. They may also prescribe rhythm control medicines like sodium channel blockers or potassium channel blockers. Another way to correct your heart rate and rhythm is through certain procedures. One example is an electrical cardioversion, which uses electric shock to reset your heart rhythm and return it to normal. Another procedure is an ablation. An ablation destroys the small areas of heart tissue that disrupt your heart's electrical signals and cause the irregular heartbeat. After ablation, some people with AFib may even need a pacemaker to keep their heartbeat steady. But the primary goal of treatment is to make sure you're protected from having a stroke. This is done with a blood thinner. Let's take a closer look at a couple of different options: warfarin and a newer option called direct oral anticoagulants, or DOACs for short. So how do blood thinners work? Unlike their name suggests, they don't actually thin the blood. Instead, they work by lowering the blood's ability to form clots. And different types of blood thinners work in different ways. Warfarin works by interfering with vitamin K and other factors in your blood to slow down its clotting process. Because foods and other medicines affect how warfarin works, people taking warfarin must watch the amount of vitamin K in their diet. They also must get frequent blood tests to check their INR, or International Normalized Ratio. Your INR score shows the time it takes for your blood to clot. If your score is too high, you could have a greater risk of bleeding. Too low, and your risk of getting a dangerous blood clot goes up. Remember, these blood tests only monitor your INR, not your AFib, so you should still work with your doctor to manage your condition. DOACs, on the other hand, don't have these limits. This group of blood thinners slows down the blood's clotting process by targeting just one of the many factors involved in forming blood clots. People who are prescribed a DOAC don't have to restrict their diet or have frequent blood tests. In fact, the American Heart Association now recommends DOACs over warfarin to manage stroke risk in people with AFib. And what about aspirin? In the past, it was prescribed by doctors to certain people with AFib and a very low risk for stroke. But as of 2019, the American Heart Association no longer recommends it to prevent AFib-related stroke, even for people with a very low risk. Now you know more about AFib, the risk for stroke, and some treatment options. The last important point to remember is that AFib and its related stroke risk is manageable with treatment. Of course, this was a lot of information, and much of it may have been new, so be sure to ask your doctor any questions about what you learned today. They can talk with you about what treatment approach they believe is best for you. In the meantime, look for more videos from the ClotWise education program. You can learn how stroke risk can increase over time, and about a tool called the CHADS VAS score that can help you understand your own risk level. Until next time, I'm Dr. Matthew Becker. Thanks for watching.